So millions of people are walking around the world right now without knowing they have diabetes. Wow. Because according to the International Diabetes Federation, about 1 in 2 people were not aware of their diabetes diagnosis, with Africa, West Pacific, and Southeast Asia having the most undiagnosed individuals. Just maybe you're wondering, could I be part of these people? Well, if you stick with me to the very end of this video, you'll be able to determine whether you need to be concerned or maybe you just need to calm down. Hi everyone, I welcome you to the Diabetes Specialist Network. My name is Awe Oluwapelumi. I am a trained diabetes specialist nurse here in the UK, and on this channel we talk about everything to do with diabetes for the benefit of people living with diabetes, for healthcare professionals, for students, and for everybody. There are 2 major categories of things to look out for before going for that diabetes screen or before having that blood test taken. One is the risk factors that predispose you to having diabetes, and the second are the signs of elevated blood glucose levels. But before talking about all of these things, I'd like us to quickly define some terminologies that might reoccur along the course of this discussion. 1. Chronic disease. Chronic disease is a long-lasting health condition that requires ongoing treatment and or monitoring. So what that means is even if this disease has been treated, you still require some form of monitoring to make sure it's not resurfaced or to make sure you're not suffering some background complications. 2. Insulin. Insulin is an hormone produced by the pancreas, which often function like a key that opens up the cells to allow glucose to go in for the production of energy. 3. Insulin resistance. In insulin resistance, the insulin, which we earlier described as the key that opens up the cells, is unable to do this work efficiently, and because of this, the body tends to produce more and more insulin in order to help the cells open up for glucose to get in. The 4th is insulin insufficiency. And insulin insufficiency basically happens when the cells that produce insulin is unable to do this efficiently, and this happens as a result of a prolonged period of insulin resistance or an autoimmune destruction of the cells that produce insulin within the pancreas. Now, having discussed and defined all of these terminologies, we will then define what diabetes is. Diabetes is a chronic disease that occurs either when the body cannot effectively use the insulin it produces, called resistance, or when the pancreas does not produce enough insulin, called insufficiency. Type 2 diabetes basically happens as a result of the body's resistance to insulin, while type 1 diabetes happens as a result of autoimmune destructions of the cells that produce insulin in the pancreas. Now, let's talk about the first category of things to look out for, which are the risk factors. And one is obesity. Obesity is one of the biggest risk factors for type 2 diabetes. If you're severely obese, there's a high chance that you could have type 2 diabetes. As a result of this, a term called diabesity has been coined out to show the strong relationship between obesity and type 2 diabetes. Though obesity is majorly measured by body mass index, which gives us an insight to your overall body weight, the true variant here is the weight around your belly. So the fat surrounding the visceral organs, which are the organs usually around the belly, produces a chemical that increases your body's resistance to insulin. 2. Family history. So the thing here about diabetes is that it definitely runs within the family. If you have one parent or both parents or even your siblings who have diabetes, there is a very high chance that you could also come down with this same condition. But here is the good news, especially for type 2 diabetes, for those who have type 2 diabetes running within the family. The fact that you have these in your genetics doesn't mean you would automatically have it. It doesn't mean it's a done deal for you. Why? Because if you take some measures as soon as possible, you could be preventing this. And these measures include staying active and also watching your diet to ensure you are not putting up weight within your belly. Okay, like we described earlier on. Genetics, however, doesn't often favor those who have type 1 diabetes or some form of autoimmune condition present within the family. Unlike type 2 diabetes, type 1 diabetes often happen as a result of the autoimmune destructions of the cells present within the pancreas, and this can hit children or even young adults at any time and anywhere. So we're talking about people who have been absolutely fine and active all the days of their life, and then just in one moment, all of these pancreatic cells have been destroyed completely as a result of autoimmune condition. So this is often a very hard truth to embrace, and it's not just what you do, it's not about what you've done wrong, it's just your body being itself, it's just your immune system all going rogue. So the next is diet. Contrary to popular opinion, eating sugar doesn't directly give you diabetes, but it is all of these eating patterns that does. Eating patterns that promote weight gain and inflammation, diet high in processed foods, refined carbs, and trans fats create metabolic stress. On the flip side, diets rich in fiber, whole grains, and healthy fats are protective. The Mediterranean diet, for instance, can significantly reduce your diabetes risk. The next is ethnicity. This is kind of uncomfortable to discuss, but it is medically crucial. Your ethnicity affects your diabetes risk. African Americans, Hispanics, Native Americans, and many Asian populations have 2 to 3 times higher diabetes rates than white, even at the same weight. And because of this, the BMI expectations of this ethnic group have been reduced. The next is history of gestational diabetes. And this is for women out there. If you've had gestational diabetes in your previous pregnancy, consider this as your body giving you an early sign that there is some form of insulin resistance going on. Gestational diabetes often resolve after childbirth, but later in life, your risk of diabetes can be significantly higher. The next is PCOS. More than half of women with PCOS, which is called polycystic ovarian syndrome, will develop type 2 diabetes by the age of 40. PCOS causes insulin resistance, which is the same metabolic process or the same metabolic problem that happens with people who have type 2 diabetes. If you have irregular periods, excessive hair growth, unable to lose weight, this can be an early sign that you might have diabetes later on, and this can be an early sign for you to get screened for diabetes. The last is medications. There are certain types of medications, especially if taken for a long period, can predispose one to having diabetes. One of which is steroids. Examples of these include prednisolone. If you're on a long-term steroid, it will be best for you to get screened because steroid tends to increase the body's resistance to insulin, and you might have also noticed that your blood glucose tends to go high during the course of this steroid. 2. Antipsychotics, which include olanzapine, clonazepam, all these medications can cause weight gain, and if this is taken for a long period of time, the weight can also accumulate in the belly area, which can then lead to insulin resistance, causing type 2 diabetes. Now, let's talk about the different signs of hyperglycemia. These are signs that will give you a good indication that your blood glucose levels are elevated. Some people may not have all of these risk factors, but these signs could be present. There are 6 signs of elevated blood glucose that we're going to discuss. 1. Increased thirst. If you have elevated blood glucose levels, your blood viscosity tends to increase, and by blood viscosity I mean the thickness of your blood. So what the body does in response to this is that it keeps drinking loads of water in order to dilute this blood viscosity. The second sign is increased urination. If you drink loads of water, you will definitely pee loads of water. It's that simple. 3. Blood vision. Extended period of hyperglycemia or elevated blood glucose tends to damage the blood vessels at the back of the eyes or even cause the eye lens to be swollen, and this can lead to blood vision. 4. Unexplained weight loss. Because your body is not getting enough glucose for its source of energy, it tends to break down fat to derive energy, and this is often followed by an unintentional weight loss. 5. Recurrent infection. Sugar, most especially elevated sugar, serves as a perfect breeding site for organisms such as bacteria that cause infection. Areas where this infection often happens include your genitals, urine infection, and even ear infection. The 6th sign is tiredness, and this is simply because you are not getting enough energy from glucose. Most people get lethargic. They don't do those things that often give them pleasure. Some people even have headaches, and all of these are the signs of elevated blood glucose. One bonus sign is called acanthosis nigricans, and all of this grammar simply means dark pigmentations that are formed at the creases of your skin or the folds of your skin. If you have any of these and it's not directly related to the fact that it's not been washed, this simply means that your body has some form of resistance to insulin. Now, if you have a cluster of all these risk factors and signs and symptoms, you'll be doing yourself a very huge favor by getting screened for diabetes. Your healthcare professionals will normally take blood tests such as fasting blood glucose and postprandial blood glucose, or even HbA1c tests to give you a definite diagnosis. I'm sure you've learned one or two things from this video. Please give it a thumbs up, engage the comment section, send or share with your loved ones, and most importantly, if you have either of these signs or these risk factors, please get tested as soon as possible. See you in the next video.